Let's bring him in. He knows sports medicine. He is from Akron Children's Sports Medicine Center. And, of course, our good friend, Dr. Joe Comgini, on board with us this morning. Joe, I know you want to go back to the Browns game last week.
Yeah, I do. Ray, it's just so amazing to me. Sat down and watched, I kept keeping up on sports, watched ESPN, Sports Center last night, 30-minute segment, right? About 15 minutes of it, the first 15 minutes of it, they were talking about sports injuries, COVID, concussions, who's going to play, who's not going to play. I think they really ought to rename that show ESPN Sports Medicine Center because so much of what they talk about is sports medicine topics. And I know that right now this week a real big segment of that and concern is about the COVID outbreak again and how it's affecting sports. And I've never in my career seen something so fluid, that's so changing and changeable, and all the different protocols and effects on our athletes. You've done just such a great job, as you always do, with the people that are right on the cutting edge of it. From our institution, Rob McGregor and John Bauer, Dr. McGregor and Bauer, you've had them on, and they do a great job. And gosh, what a gem we have in our town with Dr. Tom File, internationally known in the infectious disease world. So they've been keeping us up with the COVID protocols when necessary with our athletes. I wanted to talk about some other part of what was seen on the weekend, and it really was surprising to a lot of people, was when our quarterback, Baker Mayfield, got hit, and he got up and had to come out of the game and missed a few plays, and we saw him going into the medical tent. And I think you and I had talked about this several years ago, but again, in some of the changes in trying to reduce and save football and reduce concussion as much as we possibly can, the NFL went to a thing called the eye in the sky. And the eye in the sky is not the replay monitor just to look at plays and make the right calls on the field, but also from the standpoint of, particularly with concussion, there are sports medicine professionals that are up in the box that are looking to see if they can identify anybody whose movement pattern makes them a possible concussion candidate. So, yeah, even when this came out, they gave me a call down here. They said, can you be unbiased if you were up there? And I said, not really. And it was something I really wasn't interested in doing. But a lot of sports medicine professionals and athletic trainers, certified trainers that have been around the sidelines for a long time and managed concussion a lot, are up in the box. And we know that we've seen through the years athletes who go to the wrong huddle, go to the wrong sidelines, who are very wobbly when they get up. And all those things aren't always easy to see with as many players as there are on the field and on the sidelines. So there are professionals up in the box that call down and require that a full concussion evaluation be done in the medical tent. And that's what happened Sunday with Baker Mayfield. It is... the problem with concussion is if somebody is concussed already and they go back in a game, Ray, you know that they could be hurt much worse. And there's such a spectrum in concussion, from mild to very significant concussions, and they can be made much worse. And I don't know, through my career, I don't know how many people have stopped up to me knowing what I do and say, I played through a concussion for a series of plays or a half or, for a long time. And those are the people that really have the opportunity of getting hurt a lot worse. So I think the eye in the sky is a good idea, and I think it's contributed to why I think we're doing a little bit better with concussion in pro football. But what about the kids I care for on Friday night, the high school kids? They can't afford to have somebody in the press box looking down, and they don't have somebody doing that. And the trainers on the sidelines are paying attention to other things. And so the people, I guess you know this one, the people that are most objective and unbiased that are on the field in high school football would be who? It would be the high school officials or the referees. And so several years ago, we had a rules change in high school football that if the referees or the officials see anybody moving abnormally, they call for the medical team. They ask that that person be taken out of the game. And so that's really what serves the purpose of the eye in the sky in the high school setting, are officials on the sidelines. So, I mean, very, very frustrating with concussion for us to manage it, and for coaching staffs and things, is we can't tell them when they can expect their athlete back. So from the standpoint of, as I've said many times, MCL, here's how long it's going to be. High sprain of the ankle, this is pretty much how long this person's going to be out. With concussion, it's very variable, and we get ones that are mild that are days to weeks before they clear the protocol, and we get ones that take months to clear. I know a lot of Browns fans very frustrated with the rookie wide receiver. Anthony Schwartz has been out now. This is going on his 5th week right now. And so many times people just are not passing protocol. One of the things that I think's helped there, Ray, is we're doing a lot more concussion rehab, and I think concussion rehab has helped athletes get better quicker and get back on the field quicker. But, of course, they have to pass that protocol before they play, and it's very variable. And if we allow somebody who's concussed to continue to play, there's a very good chance that that's going to be a more significant concussion.
Well,
so I just wanted to clear that up about the eye in the sky.
I think the concussion protocol and the work on that has been really a big plus when you talk about football coverage on the NFL. And I think those who get frustrated, Joe, I think you would agree with me, are those that are used to the old times where a concussion, he'll come back in, or he might miss a half but come right back next week, because that's the way it was done 20, 30 years ago. It's not that way anymore. And I love the idea of the teams and the medical staffs looking at the big picture instead of the small picture.
Yeah, we've walked through it step by step with your audience about as we've taken it down the road with concussion, and I think there have been some good advances. And I think, fortunately or unfortunately, a lot of people that lived in the old days of the 70s, the 80s, maybe even the 60s, that were used to a different paradigm, to the different way that we approached concussion. Now more and more of those are, moving off of the sidelines, and they're telling their stories, but not as involved. And I think the newer age people know that it's just one of those things we have to live with. It's a frustrating injury, but we have to eliminate it to keep the sport safe. So I believe that we're moved forward with that, and you're quite a good observer, and I always really trust you. Know a lot about what's going on with this thing. So I just wanted to clear up for a lot of people that were asking me about the eye in the sky this week.
Perfect, Joe. Thank you, my friend. We'll reconnect next week. Thank you for the time again.
Sounds good, Ray. You have a great week.
You too. Dr. Joe Congini, Akron Children's Hospital Sports Medicine, talking sports medicine with us this time each Wednesday, and he's been doing it for over 25 years on the show.